In this video, I'm going to share with you 8 of the most common symptoms associated with thyroid disorder. Enjoy. There are 2 main categories of thyroid disorder. There's underactive thyroid, which we call hypothyroidism, and there is overactive thyroid, which we call hyperthyroidism. In general, hypothyroidism causes things in your body to slow down because a lack of this hormone causes a decrease in your metabolism. On the other hand, hyperthyroidism causes things in your body to speed up because excess thyroid hormone causes an increase in your metabolism. The following will be ranked in order of the most common to the least common thyroid symptoms that I have observed in my practice. The first category is fatigue and heart rate. In hypothyroidism, people experience fatigue, and this is due to not enough thyroid hormone production. When you have low thyroid, your cells convert less energy, hence you have less energy to use during the day. This also has an effect on your heart rate. People with hypothyroidism tend to have a lower heart rate, around 60 or below. With hyperthyroidism, people generally also experience fatigue, and you think, well, what's up with this? It's supposed to be increasing your metabolism. Well, that's right. What ends up happening is your metabolism gets ramped up so high that you're always tired because you cannot operate at that level of metabolism all the time. People who have hyperthyroidism generally have a resting heart rate around 100 beats per minute or higher. Number 2 is body weight. People who have hypothyroidism, they tend to have unexplained weight gain or an inability to lose weight despite doing all the things right with their diet and exercise. People with hyperthyroidism tend to lose weight because their metabolism is always ramped up. Number 3 is digestive disorders. People with hypothyroidism tend to have constipation because remember, low thyroid slows things down. While people who have hyperthyroidism, they tend to have more frequent bowel movements. Number 4 is temperature sensitivity. People with hypothyroidism tend to feel cold and they would prefer to be in a warmer environment. People with hyperthyroidism tend to feel more hot and they would prefer to be in a more cold environment. Number 5 is mood and cognitive changes. In hypothyroidism, it's common for an individual to have depression. It's also very common for an individual with hypothyroidism to have poor mental focus. In fact, one of the major complaints from my patients who have low thyroid is brain fog. In hyperthyroidism, we see patients have more anxiety. In fact, you may have a feeling like you have drank a lot of caffeine even though you haven't. You may feel shaky. In fact, at rest, you may have a little bit of a tremor because of the excess amount of thyroid hormone. Now, with hyperthyroid, we also see brain fog. Number 6 is hair loss. In both types of thyroid conditions, we often see people have dry, brittle, and thinning hair. Number 7 is skin and eye changes. In hypothyroidism, you may have puffiness under your eyes, you may have puffiness around your neck or your arms or your legs, and in extreme cases, we call this myxedema. Also, you may experience dry skin. In hyperthyroidism, you don't have the puffiness of your skin. In fact, your skin is like almost paper thin, and it will also be dry. Concerning eye changes with hyperthyroidism, some individuals may have bulging eyeballs, and this is usually associated with autoimmune hyperthyroidism. Number 8 is goiters and nodules. In hypothyroidism, the thyroid gland might swell up if you are not getting enough iodine in your diet, or if you have autoimmune hypothyroid, which causes swelling of the gland as well. In hyperthyroidism, typically we will see a nodule or a tumor. If you are experiencing a bump on your thyroid gland, don't wait. Make sure you go to your doctor as soon as possible to get it checked out. And to learn more about thyroid nodules, check out this video I made right here on that topic. And if you want to learn my top 3 best dietary supplements for hypothyroidism, check out this video right here.